It is no longer news that the rating by the National Bureau of Statistics (NBS) ranks Oyo State as one of the 10 highest revenue-generating states in Nigeria based on internally generated revenue (IGR). This feat can be attributed to the pragmatic leadership of Governor Seyi Makinde, the engineer with the Midas touch. He has successfully succeeded in lifting the state to an enviable height with his phenomenal projects. This transformation is responsible for the influx of investors into the state to tap from the benefits inherent here. Stakeholders in the tax industry also picked Oyo State as the place to hold the 157th Joint Tax Board meeting, all thanks to the peace that exists in the state. The first port of call is the residence of Governor Seyi Makinde, where the chairman of the Federal Inland Revenue Service, Dr. Zach Adedeji, led a delegation to pay the governor a courtesy call. Next is the business of the day, the meeting of the Joint Tax Board of Nigeria, the convergence of stakeholders and experts to address the tax-related matters, evolve a workable, effective and efficient tax system across the states, as well as find amicable solutions to challenges of tax jurisdiction, among others. This is the 157th edition of the Tax Board meeting. The Federal Inland Revenue boss in his address says, the meeting is deliberate and to fashion out ways of relieving the burden of the poor instead of compounding their burdens with more taxes.
What I would not expect is to define system that will tax informal sector. The only thing is to formalize the informality of the sector. Because if you think shoemaker are informal, tailor are informal, so what will you say Gucci is? What is Louis Vuitton? Are they not shoemaker? Are they informal? But they formalize them, and which I think the use of data will do. So I want the focus to be on how to formalize the informal sector, not defining system, how to collect money from market women. No, it is how are we going to formalize the operation of market women and men so that they can fit into existing tax law that we have.
On the part of the state, the current administration says it has built the template not only to improve internally generated revenue, but to increase the prosperity of the people.
From our experience in the Oyo State Internal Revenue Service, we have been that with regards to widening the tax net and improving revenues, there is no mountain too great to climb, and there are no challenges too huge to surmount once the right approaches and measures are taken. I'm proud to inform you that through our consistent and conscientious handling of tax matters in Oyo State, we have not only succeeded in growing the state's internally generated revenue from an average of 1.6 billion per month in 2019 when His Excellency came into power to about an average of 8.6 billion per month in the first quarter of 2025.
While declaring open the meeting with the theme Taxation of the Informal Sector, Potentials and Challenges, Governor Makinde said that his state's massive improvement was a function of his administration's decision to ensure that its people are productive and taking concrete steps to bring more people into the tax net without burdening them.
We have taken concrete steps to bring more people into the tax net without burdening them unnecessarily. So our initiatives include mass tax education, where you let people know you want services, we have to find a way to pay for it.
Governor Makinde called for effective and inclusive solutions to Nigeria's tax challenges, particularly in addressing the informal sector and improving the system, stating that for the country to break the poverty barrier and record increased economic prosperity, it must rely less on natural resources and move towards mobilizing its people to be productive and to possess knowledge, skills, and engage in intensive productivity.
economic prosperity cannot be based solely on your natural resources. For you to have economic prosperity, you must ensure that you go out there, mobilize your people. You must have knowledge and skills. And you must also have intensive production. You must produce something. That is when you can move from being resource rich to economic prosperity.
On the concerns for artisans and low-income earners, tax experts say efforts are on the way to ensure they are not made more vulnerable, but productive and responsible.
The mantra of this government is not to tax poverty, but to tax prosperity. Not to tax seeds, but to tax fruits. And one of the ways to achieving this is to get people to formalize, those in businesses, to formalize.
The focus of the tax authority is to ensure that the economy thrives. And when it thrives, then we're able to tax the profit that they make. So essentially what we are trying to do in the informal sector is that even the bar is going to be raised in such a way that the people at the lower pyramid will pay little or nothing, but they will be in the tax net. So we'll help them to grow, formalize their business so that they will now become taxable when they earn more than the threshold which has been set.
Today, there are so many organizations and individuals in the informal sector that have no business being in the informal sector, but they choose to hide under the informal sector so they can, avoid taxes or completely, evade taxes. So we can distill, using data, using technology, you can distill, separate those that should be subjected to taxes from those whose income are below the tax threshold. So data is the key.
The various sessions held during the meeting was an avenue for these tax experts to proffer more strategic ways that will benefit all strata in the Nigerian economy.
Even yet, the evil one in some people could suddenly crush your dream and make you vulnerable. But hold on. Someone, somewhere could be saying something and will say something. Be your brother's keeper. If you see something, say something. The security of life and property is a collective responsibility. If you see something, say something by calling 615 and the emergency response team will be there.
Or call 090 7449 1249 or visit Oyo State Crime Alert platform.
The Oyo State Governor, His Excellency Engineer Seyi Makinde, says a big thank you for your support to keeping the Paysetter state safe and secure.
The House of Chiefs was packed full to capacity, with students drawn from various public schools across the state. 792 and for the 6th consecutive year, the girls are celebrating this annual event with no other person than the mother of the state, the First Lady of Oyo State, Engineer Tamunominini Makinde. Menstrual Hygiene Day, observed annually on May 28th, is dedicated to breaking taboos and raising awareness about the importance of menstrual hygiene management. These young ladies have been selected to be part of this year's event. Speaker after speaker, they take the girls through an open conversation on how to prevent health risks and ensure the menstruation is managed with dignity.
Do not let anyone bring you down or make you feel bad about yourself anytime you are on your period. Let's support each other, for together we can achieve our feat. When menstruation is a normal part of life, this will mean girls miss school because of their period. No one is teased or shamed for something natural. Period-friendly world means that every girl has access to pads and sanitary products needed for proper hygiene.
During menstruation, stomach ache occurs. What can we use? Yes, there could be some form of menstrual cramps, and if it happens like that, tell your parents or tell your teacher, because I wouldn't want you to abuse drugs. But the drugs that you can use are non-steroidal anti-inflammatory drugs that can take care of inflammation. Ibuprofen comes in place, but for some students that have ulcer, I wouldn't prescribe ibuprofen for you, because you may take the ibuprofen and it may aggravate, it may make the pain to be worse. So, but tell your parents, paracetamol is okay too, that you can take, but don't self-medicate. Let your teacher or your parents guide you.
Mrs. Makinde, in her admonition to the girls, emphasized the importance of menstrual hygiene among female students in the state. She urged the girls to view their periods as a natural part of their femininity rather than a source of embarrassment. She also had a word of advice for the teachers. The First Lady tasked teachers across the state to prioritize the well-being of their students, particularly the girl child, during their menstrual period.
Some people insert things into their vagina because they want some normal discharge to stop. And it's itchy and it's irritating. Maybe you've contracted disease or infection. You need to go and see the doctor. Don't be ashamed. As you're coming back from school, go to the primary health care center near your school. You can take permission from school, ask your teacher to give you somebody, go with you to the primary health care near your school. And tell them what is wrong with you, and they will help you. Don't be what? Don't be what? Don't be afraid. And don't be shy. It's your body.
During the program, students learned about different types of sanitary products and how to maintain proper hygiene during their periods. The program included the distribution of sanitary pads and towels to students, along with cash gifts to promote menstrual hygiene and support the girl child. The event aims to break the silence surrounding menstruation and promote awareness about menstrual hygiene.
Everybody hands up! Get on the floor! Now! Emergencies can happen anytime and anywhere. What would you do? How would you protect your family when it's just you and your family at the most critical moment of the night? What would you do in times when fire is everywhere? When nature is at its worst and things are beyond your control? Who do you call? You can call the Oyo State Citizens Inquiry number 615. Call is free at any time and the emergency response team would be there to rescue you. The security of life and property is a topmost pillar of priority to the government of Oyo State. The Oyo State's Governor, His Excellency Engineer Sheyi Makinde, says a big thank you for your support to keeping the Payseta State safe and secure.
Governor Sheyi Makinde's emergence about 6 years ago in Oyo State has ushered in a new path of governance, renewed trust, people-centric and unprecedented growth across all sectors of the economy. Under Governor Makinde's administration, Oyo State has become a testament to visionary leadership and transformative governance. Since the people of Oyo sectors of the economy, security, health, education and infrastructure have witnessed tremendous growth under Omitutun 2.0 program tagged Roadmap for Sustainable Development 2023 to 2027. Governor Makinde's administration has prioritized the revitalization of the healthcare system to ensure accessible and quality medical services for all citizens.
The commencement of this scheme today makes it the ninth door created by OSHA, leading to the same group of access to quality healthcare services by residents of Oyo State. The doors have conventional OSHA scheme, community-based insurance scheme, pensioners and old people scheme, partially selected insurance scheme, basic healthcare provision fund, adoption model of which His Excellency the Executive Governor is the chief. Diaspora Contributory Scheme, Safer Health, Safer Oyo, and now these new entrants, Public Primary School Pupils Insurance. All the above-mentioned models are giving access to quality healthcare services to over 250,000 residents of the state, and are reduced out-of-pocket expenditure to an average of 10% from the current rate of 75%.
A cornerstone of this effort is the comprehensive renovation and equipping of 264 out of the 351 primary healthcare centers across the state, aiming to provide at least one functional PHC in every ward.
For federal government, our functional primary healthcare facility in each ward, and 354 of them.
To address the shortage of medical personnel, the government has recruited doctors, nurses, and other healthcare professionals, enhancing service delivery in both primary and secondary health facilities.
For over 30 years, we've not gotten accreditation for the physiotherapy. Your Excellency, we have been granted that under your leadership after 30 years. So we have well strategic workers that will be able to assist.
The establishment of pressure swing absorption, PSA, oxygen plants at Jericho Specialist Hospital and State Hospital Oyo has significantly improved emergency response capabilities. To strengthen healthcare financing and accessibility, the administration of Governor Makinde has increased enrollment in the Oyo State Health Insurance Scheme from 45,000 to 300,000 beneficiaries.
Oyo State Health Insurance paid up to 735,366,023 core as capitation to all accredited hospitals in 2024 alone. Through this, heads of various hospitals have made significant headway in infrastructural upgrade of their facilities, procurement of essential tools, provision of drugs and consumables.
Additionally, the implementation of a drug revolving scheme in 26 PHCs ensures the consistent availability of essential medicines. Oyo State Hospital Management Board also got the mandate of His Excellency to recruit new staff in order to improve the working strength and serve more people in the state without undermining the quality. These concerned efforts have yielded measurable outcomes, including a reduction in maternal mortality from 296 to 244 per 100,000 live births and an improvement in neonatal mortality rates.
Our health system has seen unprecedented transformation through robust investments in net infrastructure, human resources, and system strengthening initiatives.
The Free Health Mission of the Makinde administration has also assisted in great measure, taking healthcare delivery to the doorstep of the vulnerable ones at no cost.
These interventions were designed to bring healthcare directly to the people, particularly the underserved communities, and have since become a cornerstone of our public health strategy.
The most recent is the handing over of various medical equipment to the management of the Ring Road State Hospital at Oyo Ibadan. The governor, who was represented by the executive assistant on administration, Reverend Idowu Ogedengbe, said that the delivery of the equipment was in line with the government's vision to elevate specialist hospitals like the Ring Road State Hospital to the standard of university teaching hospitals in the area of training and healthcare delivery through the provision of necessary medical equipment.
So, hand over the following equipment that were supplied to the Ring Road State Hospital by Oyo State. One patient monitor, one operating microscope, one cataract set, 1 surgeon chair, 10 oxygen outlets, 10 humidifiers, 1 4x4 manifold, 1 ceiling mounted operating unit, 2 diatonic machines, 1 operating theater table, and 1 anesthetic machine. Altogether, these are 30 items today to the glory of God and for the benefit of humanity, and on behalf of the Executive Governor of Oyo State, I have the honor and the privilege to cut the tape towards the handover of this equipment.
As Oyo State continues on this trajectory of progress, the achievements of the past 6 years serve as a testament to effective and people-centered governance.